Good morning. It's Saturday morning. One of the first Saturday mornings that I've ever had off as a doctor. It's a bit of an over-exaggeration, but I've given up weekends for the first time in 20 years. I will never ever work another weekend. So, I've woken up today to a Facebook post on TRT in the UK. One of my guys presented a GP letter that we routinely give to guys who request them. And the purpose of this is to hopefully get the doctor on board with the program and hopefully have the testosterone prescribed by the NHS and have his blood tests done through the NHS as well. So ergo saving my guys money. Radical concept in the private sector. So the response from the GP was we'll have to check with the endocrinologist. The response from the endocrinologist was no chance you yeah, he's not impressed that he's gone private, and he's actually too angry to comment. Rather unprofessional. You know, this guy has low testosterone confirmed through blood tests. He's symptomatic. Interestingly, he's got low SHBG, and I mean super low. We have seen this before. He's actually had genetic testing that's gone to the Mayo Clinic in America, and it's going to take 18 months. Yes, 18 months for the results to be back. What will be the outcome if there is a genetic abnormality? Yes, Mr. X, you have a genetic abnormality that is causing your SHBG to be low. We don't know what to do with that information. I apologize for making you wait 18 months to tell you we don't know what to do with that information. Well, we've seen it before. And what we've done, radical, is we have microdosed TRT and HCG. Shock horror. And guess what happened to the single figure SHBG? It went from 2 to 20. Wow, how did that happen? SHBG is really interesting, and we don't fully understand everything about it, but we do know that it's there because the half-life of testosterone is very short. So it's to help facilitate growth and repair. It's to make sure that the testosterone that gets produced by the testicles isn't metabolized and excreted. So we do need testosterone throughout the whole day, not just during the periods where you should be predominantly anabolic. So, ergo, the super low SHBG guys, when they have low levels, it tends to reflect the body trying to allow some free testosterone in the body. So you do have the qualitative and quantitative effects of having bioavailable androgen levels. So when you do have a super low SHBG, your body tries to help you. Much like when you have a high SHBG, your body tries to help you. I had a guy again yesterday actually who had a SHBG of 120, I think it was, and he had a total testosterone of 36.6. This guy is actually superhuman because he'd done a course of testosterone through an underground source, and he'd come off 2 months later. He'd got normal pituitary function and a testosterone 36. So incredible. But he had this elevated SHBG, which was obviously preventing enough testosterone to be free, and hence the conversion to free testosterone, DHT, and estrogen. So with him, we've opted for lifestyle measures, and he's going to reduce his alcohol consumption because alcohol can increase SHBG. He's going to have a more high protein diet, and there's no other risk factors really. He's been to his GP. He's looked for a more sinister cause because obviously a super elevated SHBG can be from a sinister cause. So the whole thing's quite complex. You know, we do have a way of treating low SHBG guys, and we do have a way of treating high SHBG guys. Now, that methodology has come from common sense and an appreciation that radical changes within the body often create a radical response. And what we don't want to do is create a radical response. Why don't we want to create a radical response? Well, we need to remember homeostasis. The body likes balance. So the body does not like change. You can force change and stay healthy, but you have to do it slowly and methodically. So again, when it comes to testosterone replacement therapy, things must be done slowly and methodically. I like to practice something called common sense medicine. Why do I practice common sense medicine? Because it's common sense. So, you know, we have a lot of big fish in little ponds within medicine, and that applies in endocrinology, where we have had some really scary horror stories. An obvious one would be a guy who's fortunate enough to get testosterone under the NHS, and he's gone back for a review and his levels are normal, so he's had his testosterone stopped. Scary stuff. So lots of big fish, little ponds, and there's no consensus of opinion. There are guidelines out there that doctors should be adhering to. However, it's potluck as into whether these doctors hold any weight to these guidelines. We should all practice evidence-based medicine. So since guidelines are formulated through best evidence, surely if you adhere or uphold to practicing evidence-based medicine, you should be adhering to the guidelines. But these big fish in these little ponds think they know better. Now, we have a large amount of guys who come from the NHS who are either dissatisfied with the level of care, service and commitment shown by the NHS, or they just want a better service. You know, the NHS is under an incredible amount of pressure, so you know it's struggling to do what's best by the patient, and it has patients' best interests at heart. But when it comes to male hormone optimization, it struggles because these big fish in these little ponds, they want to protect their intellectual kind of whatever. They're you know, it's quite absurd. But so even with guidelines, they're often not particularly interested. So this radical concept of common sense medicine should encompass evidence-based medicine. Now again, evidence, the validity of the evidence is based on the strength of the study or strength of the studies. You know, different studies have different weights. So drawing conclusions from case studies, drawing conclusions from qualitative studies, you can't lend much weight to these, but it can give you an appreciation. It can give you an avenue to look into further to see whether this is something that you should pursue. Now, unfortunately, there's not much interest in testosterone replacement therapy, and I believe it's because we are not adopting a prevention versus cure model. The modern medical system is cure, not prevent, and unfortunately the pharmaceutical industry is funding most of this research. So at the Men's Health Clinic, we will never be influenced by pharmaceutical companies. We will always be influenced by our patients and doing the best by our patients. So, common sense medicine. We should be looking at the evidence. We should be looking at other systems. Now, unfortunately, most doctors specialize. Now, they specialize for a very normal reason. You want to be a specialist in your field. But we know that health encompasses more than one system. So I'm a specialist in X, but I appreciate that A to Z is also important. So we talk about health, it's not rocket science, when it shouldn't be rocket science. Lifestyle, nutrition, exercise, then hormonal health, then modern medicine. That's the model we should be looking at. So I can be a specialist in testosterone, and I hope you guys realise that I am. But I also need to have an understanding of everything else in order to do my job effectively, because factors, elements, issues all influence testosterone that a traditional endocrinologist wouldn't necessarily address appropriately, much like a GP. Blood pressure, exercise helps. So you'll get some bare bones advice about exercise. What would that advice be? You should get some exercise. Well, that's not very helpful, is it? So, we have an awareness that we need to address these other factors, but we actually don't do anything about it. So it's almost a waste of time. When you've got a fat doctor, talking to a patient about type 2 diabetes, it's yes, you should get some exercise and lose some weight. Well, why don't you start, mate? Lead by example, and I think that's important. You don't have to have low testosterone to understand testosterone. Much like you don't have to have cancer to understand cancer. So, there's a few people out there that thinks you can't understand what it's like if you don't have it. Well, people have empathy, hopefully, and if you don't, then you should go back to being an amoeba, because you're just sucking oxygen, mate. So you need to address the whole person in order to affect a positive outcome on the patient. And if you think of the patient as a medical condition, then you're missing the point, because you must think of the patient as a whole and incorporate other issues, other factors, other things that will affect this condition that you're looking at and are trying to address. Because if you want to address it effectively, you need to encompass all of those aspects. So it's not rocket science. Well, it shouldn't be rocket science, but the NHS hasn't got much time, and it does its best, but we have some big egos. We have some massive egos who believe their way is the only way. Now, a good scientist, a good clinician, should always look and critically analyse their practice. So our practice has evolved over this last 3.5 years. I mean, my God, we started with Nabido. Sorry, guys. I do apologise to the guys that started with the men's health clinic, but we've all got you switched over now. So, logical, methodical approach to medicine. That's what we should be adopting. So what we're going to do with this guy, hopefully, is because he's going to get a negative response from his endocrinologist, who is too angry. He's too angry. He's too angry to comment. Perhaps you should have a look at our practice. Perhaps you should have a look at the positive outcomes, the improvements in the SHBGs, the improvements in the free Ts, the improvement in the estrogen, the improvement in the qualitative markers, the lean muscle mass, visceral fat. We're going to be demonstrating these improvements in these parameters, so that we can not only have happy patients, but hopefully affect a positive change to how testosterone deficiency syndrome is addressed and practiced by doctors, because it is a practice. Medicine is a practice, so it's ever evolving. We are constantly looking to ways of improving our service, so we will continue to evolve. We've got a very solid protocol or practice, so we're happy, but we are continuing to evolve day by day, constantly looking at ways of improving our service. But the NHS and the endocrinologists, they're very much stuck in their ways, because they're practicing evidence-based medicine, because they're practicing safe medicine. And it's slightly contradictory, the fact that they think they're practicing safe medicine when they're not adding HCG to their protocols, they're not looking at estrogen, they're not actually really fully appreciating the importance of SHBG in male hormone optimization. They're not fully appreciating the importance of addressing the person, not just the condition. But more for them. You've got the private providers, Give Me Strength, who base their care around their business model. So, you can have bespoke TRT, but funnily how bespoke TRT is 125 of Sustanon every 5 days, and when the estrogen rises, they're going to give you 0.5 of anastrozole. That sounds very bespoke to me. Let's chuck away half of the Sustanon, because we can probably justify that. But if we actually adopt a logical and methodical approach, and if we use Sustanon, then we do know about the prop ester, and actually to achieve stability you need to look at the shortest acting ester. So that would mean really tiny doses, say 0.2 every other day. But that wouldn't fit in with your business model, would it? You couldn't really justify guys going, okay, 0.2 mil and then chuck away the rest, 0.8 mil every other day. If they did, wow, you'd be buying your Ferrari, wouldn't you? But common sense would prevail, and people will realize that, this is literally about a business model that necessitates, or you can justify throwing away half in your minds, because you are acting in the best interest of your clients. We say clients, not patients, because you don't have patients, you have clients, and it's a sales consumer relationship. So you've got the providers who are literally using testosterone as a cash cow, masquerading using testosterone to help people. I go to work every day and I love it. It's It makes me happy knowing I'm helping people. Yes, you know. Do you know what? I don't know how. I'm gonna tot up how many people we've got from providers, how many people we've got from the NHS. I'd like to thank you for all your custom, because the worse job you do, the more we look like rock stars. But all we're doing is practicing common sense medicine safely and effectively with our patients' best interests at heart. Something that you try to say, but you don't do. You know, there are more and more of these online companies coming through because they are realizing that testosterone's big business. It shouldn't be big business. It should be a medical condition that's managed by medical doctors. And you've seen a business opportunity and you're running with it. Yes, but I didn't have any money before I started my company. Okay, that's not an argument. It's disingenuous that Dr. Stevens asked for money. Well, hold on, it's my profession. I've been a doctor for 20 years. I've dedicated my career to addressing testosterone deficiency syndrome and treating guys with gold standard care. So yeah, I do charge money for my services. Unfortunately, what a peculiarity we have in this modern world is the fact that we are the only species on the planet that has to pay to be here. But you know, to have value, you need to charge money, and also I need to get my Ultima. Well, perhaps not. I would like to get my Ultima in the future, but I'll do it ethically, and do it through hard work. So, you know, you've got more and more of these companies coming to the front. I won't mention names. Well, I can't be bothered. Whatever. But yeah, you've only got to do an internet search, and you're going to see new companies with jacked up guys, promising you the world, promising you optimization, promising you to become alpha dog like me. No, you know, what we need to have is a common sense approach. We need to remove these bozos from the marketplace. Testosterone's a marketplace? That's not right. We need more doctors to be involved, but having a consensus of opinion from doctors who have massive egos is hard. So we will continue to do what we do, work in the best interests of our patients, and we will look to effect a change to how testosterone is managed, practiced, dealt with, both through the NHS and through the private providers, because they will need to keep up, because through increased education, through increased awareness, they will suffer, because people will be aware that the best way of doing things is the Men's Health Clinic way of doing things. So, sink or swim, boys. So yeah, this guy was, let's get back to the point, 25 minutes. This guy was super low SHBG. We will get him optimized, and I want him to go back to his endo, slam those blood test reports onto the desk, and do a very famous scene from Boys in the Hood. And I won't say the expletive, but it's Domino. And yeah, we will effect a change. It's going to be slow, but we'll continue to work. And yeah, watch this space, guys.